Once again, thank you all so much for joining us. We are honored to have you here. My name is Barbara Spear. I am a lawyer. I just graduated from Stanford Law School, and now I'm working at PayPal here in the Valley. I'm honored to introduce you to the Brazilian Silicon Valley a new session that calls The Path to Innovation. Medical research and development of new medical technologies comprise a large chunk of global healthcare spending. With that in mind, it is important to consider how to guide such an academic research to make it based on the most relevant current clinical needs. Moreover, for the breakthrough medical discoveries to generate impact, we must turn these scientific discoveries into businesses. Today, worldwide health tech investments grow at a faster rate than most of the other areas with disease. For this discussion, we will have Paul Yock and Brook Byers, moderated by Antônio Emílio de Moraes Neto. Paul Yock is Martha Mayer Whalen Professor of Medicine and founding co-chair of Stanford Department of Bioengineering, with a courtesy appointment of the Department of Mechanical Engineering. He's also founder and director of the Stanford Byers Center for Biodesign. After completing his undergrad and graduate studies at the University of Oxford, Paul received his MD from Harvard Medical School, followed by his fellowship in cardiology in Stanford. Paul has authored over 300 peer-reviewed publications, chapters, editorials, and textbooks. He internationally known for his work in inventing, development, testing new devices, including rapid exchange TM, extending a balloon angioplasty system, which is now a primary system in use worldwide. He's also invented the fundamentals approach to intravascular ultrasound imaging and founded cardiovascular imaging system. The other speaker is Brook Byers. He has been a pioneer in precision medicine, enabling its creation through the financial backing of companies that venture into the field early and through his mentorship coaching with their founders. A venture capitalist since 1972, Brook formed the first life science practice group in the profession in 1984. KP, that has invested and helped build more than 125 life science companies, many of which served as a foundation of precision medicine through their use of advanced testing, targeted therapeutic, molecular biology, and genomics. He graduated with a degree in electrical engineering from Georgia Tech University and received his MBA from Stanford. Lastly, our moderator is Antônio Emílio de Moraes, which is an entrepreneur and venture capitalist. He's co-founder and CEO of XP Health, a Palo Alto-based company disrupting the vision care market. Mr. Moraes also co-founded and is board member of Vox Capital, one of the world's most recognized venture capital funds focused on impact investment with primary focus on health tech. He's also co-author, co-producer, and narrator of A New Capitalism, an international documentary available in 190 countries through Netflix, iTunes, Google Play. Moraes served in several boards for profit or non-profit companies, including Global Agenda Council for Latin America from World Economic Forum, the Global Social Impact Investments, and Votorantim Group. Please join me welcome, after this very long introduction, Paul Yock, Brook Byers, and Antônio Emílio de Moraes.
So hello, everyone. It's a great honor to be here, moderating this panel with two giants from the healthcare biotech industry here in the US, even in the world. We will start with a presentation from Dr. Paul Yock, aka Paul. And please go ahead. I think we have already the slides set up.
So I'm a professor, and I cannot talk without showing slides. So bear with me just for a few minutes. I wanted to, after talking with Antonio, I wanted to talk a little bit about how we see the role of the university shaping technology transfer, and how universities over the last, especially 10 to 15 years, have developed disciplines of entrepreneurship and innovation. And this is the flavor that we take at Stanford. We start with a philosophical point that is, although there is a lot of wonderful innovation that comes from inventing a technology and then figuring out how that technology is deployed, there is in health tech, there's an interesting mirror image approach, and that is let's see if we can make this work. Now we'll try to go forward.
Try clicking down.
Okay. There we go. I'll get better at this as we go along. So the other approach is to start purely with the clinical need, and that's what we emphasize with the training program that we call Biodesign at Stanford. This is a flavor of design thinking. How many of you have some background in design thinking in the audience? Yeah, a fair number. And so you understand that one of the cornerstone ideas of design thinking is you don't start out by inventing or creating. You start out by really understanding the customer that you're trying to serve, the empathy and define phases. And a flavor of design thinking is user-centered design, so intense focus on the user needs. Well, in healthcare, we have a problem, and that is that our user is a multi-headed monster in the healthcare environment. It would be great if we could innovate with just the patient or the patient and physician in mind, but instead we have this really complicated network of essential stakeholders, any one of whom can determine the success of the innovation that you're trying to bring forward. And to make it even more complicated, that all changed profoundly in this country with the introduction of Obamacare, and it is in the process of changing again in a way we don't understand, but is going to severely impact the innovation pathway.
That makes it a 9-headed monster.
So what do we do about that? This means that the innovation pathway in health tech is different than in the rest of tech. And so the way that we've modified the process, we call the Biodesign process, and it front loads developing a deep understanding of all of those stakeholders. And in fact, that first stage, the identifying needs, is the key stage. The mantra of our whole program is that a well-characterized need is the DNA of a great invention. All right, so how do we do the need finding? Let me just give you a short idea about how we go about that. First of all, everything that we do is in teams. We assemble multidisciplinary teams. We like the number of 4. This is a recent team that had a surgeon, a mechanical engineer, an electrical engineer, and a chemical engineer on it. We put that team together and we throw them into the hospital in a new area each year. This year we're doing ophthalmology as our theme area. We say, go live in the hospital, look at what's happening to patients, talk to the doctors, talk to the nurses, go home with the patients, understand the whole healthcare journey, and don't come back to us until you've identified at least 200 needs that, if they were solved, would be important. So there's a little psychology involved here. Our young inventors fall in love with needs too easily. You go into the hospital, you see something important, And because it's affecting patients, you care about it and you want to go ahead and solve it. The trouble with health tech, as you know, is that solving it may take 10 years and tens of millions of dollars. So you better be smart about which need you're going to take. Don't fall in love too quickly. And so this process of having lots of needs compete with each other is our way of making sure that the best need rises to the top. So we have all of these 200. The team digs into them, understands them, and they pick 2 or 3 of the most promising needs, the ones where the stakeholders are best aligned. It's only at this point, and for our fellows, this is 5 months into the program, that it's time to invent. And I love the quote that this fellow team came up with that says, given enough time, sugar, and caffeine, you will invent something. It is profoundly true that if you get the need right in health tech, you will invent a solution. I will guarantee you, if you've got the need characterized right, you're going to find a good solution. So here we use that same bit of psychology for the next step. We say, okay, you've got the 2 or 3 best needs that you're going to pursue. And now come up with at least a couple solutions for each of those needs. Let's see if we can advance. Yeah, that went forward pretty far. Okay, I'm going to back up a bit. Sorry, can we back up a couple slides? I think I'm getting some help in the back here, so that's good. Another slide, please. Okay, here we go. We're caught up. So what I was saying is same strategy, right? Young inventors fall in love with solutions too quickly also. So invent multiple solutions, have those compete, and then using objective criteria like intellectual property, regulatory pathway, pick the winner. I've gone into this in a little bit of detail. My big point with respect to the role of the university in doing that is what I've described as a discipline. It can be taught, it can be learned, it can be practiced and perfected, and we believe it belongs in the university to teach students who want to be innovators, and that is the role that we see for the university. So just to finish up quickly, the final stage is implementation, business planning. We teach the fundamentals of that. And the process has worked. So we take only innovators, students who have not done this before. We've been at this now for a number of years. Brook helped us start the program 18 years ago. But we've had 50 companies come out of the process. So every year, these teams pretty reliably come up with a good enough idea that can be funded and go forward. It's interesting. Some of these products are in pretty widespread use. I went to my doctor recently because I had some fluttering in my chest, and he reached in a box and pulled out a Zeo patch. I suspect a couple folks in the audience know what this is from experience like mine. So this was a product that some students came up with, and it is now widely used, not only across the country, across the world, starting from a basic need. So we're proud of the fact that these companies have started. We're more proud of the fact that now it's getting to be a significant number of patients who have been treated by technologies coming out of the program. We're at 1.5 million plus patients. So I think I'm going to wrap up there and hand it over. I'll wrap up with this slide that says what our product is out of the program is the people. So these folks, early in their careers, have had a chance to really get a hands-on experience of inventing a new technology and taking it forward. And in their careers, they have the chance to do this several times over. And we think that the role of the university is to give them a launch, to get them earlier, to have them understand where the potholes are in the process, and enable them to have good careers as innovators. So I'll hand off at this point.
Thank you, Paul, so much. I think a quick testimonial from me that was out of script, but I'm a 2 times Biodesign student at my time at Stanford. I can testify that the methodology is really, really deep, and it saves us, and me as an entrepreneur, like probably millions of dollars of testing ideas at the school before we go out and really raise the money. So after 1 year and a half, we went over 100 different ideas, and we interviewed more than 200 patients, all because of Biodesign. So really, yeah, encourage people to learn more about it. Let's shift gears to Brook. There's so many things that you can tell us. I think I'll start, Brook, with you were telling me about your visit to Brazil. So you were one of the pioneers in biotech, one of the pioneers in venture capital. And how was your impression of Brazil last April that you were visiting? So if you can start with this, and we'll go to other questions as well.
Yeah, I had to go to Brazil last April. I had such a great time. I've been lucky enough to travel all over the world, but it was really magical going. The reason for going was a wedding in Buzios. One of our son's best friends was marrying a Brazilian woman who's a PhD at Stanford, and we got invited to go. And through that, I told my friends we're going to Brazil, and my friend Jody introduced me to Rodrigo Xavier, who, by the way, organized this conference. He's too humble to take much credit for it. But then, if you know Rodrigo, then you know everybody, is what I learned. And Brazil is a tightly networked country, unlike any place I've ever been. So he introduced us to Pedro Bueno, who then showed great hospitality, and then to some other people who then introduced us to Luciano. I got to meet him, and God, how great is he? And then we got to meet Gitu and Fernanda Moll and David Schlesinger, and more recently, Robson, who is a Biodesign graduate as well, and quite a well-known surgeon here at Stanford. So, loved the visit. Stayed at the Fasano Hotel. How many people have been to that? Oh my God, just go stay for a weekend. Do yourself a favor. That was pretty great. But so besides the hospitality and the culture and the arts and going to the museums and all of that, and gaining 5 pounds, 10 pounds, eating, and then going. One thing that's really cool in Rio is that you can drink in the street. You can't do that here. But we'd go to bars at night, and you get your drink, and then it's just there's so many people in the bars. You're out in the street, and then people talk to each other. So it's wonderful. One of the surprises for me, though, in talking about innovation there, was the sense that I got and that I heard is that academic research in universities has an aura about it that it's supposed to stay academic, and that it doesn't have an obligation to translate out into product and into the for-profit commercial world. And that was so shocking to me because my whole career has been built on translating research out of university breakthroughs into products and into companies. Now, it's not always been that way. Our firm was lucky enough to get involved at Genentech at the beginning in the late 70s, and that was based on science and breakthrough technology and recombinant DNA out of UC San Francisco and Stanford, 2 scientists at each one. And at the time, it was considered very controversial that they were selling out to industry. But what they did is it created a culture in the company at Genentech early on where scientists who would come out of academia could publish. So they could still do basic research, they could do translational research, they could do both. They had a lot of resources because it was in a for-profit company that was well-funded, and then they could publish their work. And so it broke down this kind of barrier and suspicion about, is a for-profit company going to hold back science? And in fact, a lot of the innovation that happens in medicine that I'll talk about in a few minutes is coming out of the young, innovative companies. So I want to encourage you, when you go back, to have the universities do what you can volunteer, and like I've done for 18 years with Paul, to work with the universities to have them change this attitude, and then maybe even adopt the system that he outlined. Paul published a book on all the Biodesign methods. I have a brother, Tom Byers, at Stanford, who teaches entrepreneurship in the engineering school. Everything he does is on the web for 20 years on entrepreneurship process as well.
That's great. Brook, maybe I'll follow up still with you, and then I'll ask a similar question to Paul. If you can give us a few examples of companies that you backed that came out of academic research. Overall, like how many companies have you backed that fit this profile? And maybe like a few of your favorite examples.
Yeah, so I've been lucky enough to be involved in help entrepreneurs build about 60 companies in medical and biotech. I would say 80% are based on science out of universities. And the way we do it is we ask the professors to stay at the university. There are policies in the university that allow a professor to spend a day a week at a company. That's a good policy. Google copied that day a week, by the way, in their culture, that an employee can spend 20% of their time on whatever they want. The professors in the university are allowed to get stock in the companies, but there are strict conflict of interest rules about what they can and cannot do. They can't have company work going on in their lab in the university. So that's all well documented and well done. So how many of you are entrepreneurs and have started a company? Okay, then you know what I'm about to talk about. Almost every company has a near-death experience, right? And it's the same is true in healthcare. You never read about that much because entrepreneurs who are successful don't much talk about it, and journalists don't dig into it very much. But I'll tell a couple of stories. And we start with the needs finding. So at Stanford, they were observing with ophthalmology patients that patients with diabetic retinopathy needed to get laser treatment and to tack the retina back on the back of the eye, and they would use a YAG laser and do 10, 20, 30, 40 blasts of the laser. Very painful, takes a long time, anxiety producing, whatever. So the idea was to invent a pattern of laser pattern that would be put down just one shot. Seems obvious. No one had thought of it before because the YAG lasers were used, and what's the problem? Well, no one talked to the patients about how painful it was. I actually had it done to me as a patient and started talking with some people in the physics lab at Stanford, Daniel Palanker, and then people in the ophthalmology department. And we ended up inventing that. They did, and we built it into a company. Another quick story is Paul called me one day and said, I'd like for you to meet with a graduate student named Michael. Robeson knows this story. And I said, oh, okay, well, what's up? And he says, well, he's got an idea for dry eye. Dry eye is really painful. In the US alone, 5 million patients have dry eye conditions. 1 million is really chronic and bad. And the only thing used was Restasis. It's a drug. It's an antiprostaglandin. It doesn't really work that well. So he said, will you meet with him? So I said, okay. So he came by my office in Menlo Park, and really smart kid, postdoc, and he had an idea of stimulating a nerve above the eye called the lacrimal nerve, and that nerve is involved in tear production. And so we talked some more, and I said, okay, I think this is a reasonable idea. I'll seed you with $100,000 and go build a prototype and test it, and then come back and gather some data on tear production. Okay. So he called me like 2 months later, and he came back to my office, and he sat down, and I said, because in my job, my first question is always, show me the data. So he showed the data, incredible tear production, and he had this kind of kludgy prototype nerve stimulator with a wire sticking out. And I said, great, well, where did you do the animal studies? And he said, I said, you did test it on rabbits, right? Because rabbits have the closest thing to a human eye. So that's the animal model. And he said, no. Michael, did you test it on yourself? He goes, yes. Where? In my kitchen. Who put the wire up under your eyelid to stimulate the nerve? And he said, my fiance. I said, Michael, if you ever do that again, I don't know what I'm going to do, but you didn't have an IRB. You got to get approval to do this kind of stuff, right? But so he said, well, but do you think I'm committed to the venture? Yeah, I said, yeah. I don't know that I believe, but I believe you believe. Okay, we're going to go do this. It had a near-death experience, though, because we went on to develop this. We went to do clinical trials in Mexico City. There's a big eye institute down there that's really, really good. But it required surgical implantation of a little seed there, and then you do an induction energy transfer to it to produce the tears. The problem is, depending on the surgeon, it had different outcomes. So you're really not going to believe this story. So obviously, the team down there were despondent because that means the company was going to fail. So they all went out to dinner that night and drank a lot of tequila. And they were all goofing around in a restaurant, and they started putting straws up their nose. And one of them thought it'd be cute, and he would dip it in salsa and stick the straw up his nose, and it produced a huge amount of tears. So then they all got excited, opened their laptops, went and looked at physiology, and in fact, yes, that nerve comes down the nose. So they invented a product that you stick a probe up the nose and stimulate the nerve. That's invention, right? Okay, experimentation and invention. But I just want to close by saying, if you were here for Scott Cook yesterday, what you saw is when he went to those Toyota plants or at Procter & Gamble, what he was saying was you go and you observe, you interview maybe, but you observe, and that's what Paul talked about.
Can I follow up? There are two things in what Brook just said that I wanted to highlight. Back on the question of the university involvement and so on, has nothing to do with putting straws up your nose, these points. One is that Stanford, for reasons, maybe I'll ask you to explain, Brook, but Stanford is very porous to experts from industry coming into the university. That's part of the culture that's grown up. I think it's because of the way engineering grew up here, and the Hewlett-Packard came directly out of the university, other companies did. So it's a characteristic of the university that is really special. And I think the way you get there, if you don't have that culture, is by having some prominent professors who are willing to risk being a little bit entrepreneurial and doing something like this. You have to start with professors who have the kind of credibility that the Genentech founders had to pull this off. The second thing, and I'll be quick about this, so Brook left off a big piece of the story about Michael Ackerman and what made it work, and that was Brook personally spending a lot of time with this young man, allowing him to stay as CEO and execute well. And that's the other ingredient, I think, that we have going in the Valley. For some reason, folks are exceedingly generous with their time and provide a kind of full contact mentoring that is extremely powerful. So for what it's worth. Why is Stanford sort of so porous? Do you have a perception about that?
It's just accepted as the culture of the university. It's almost an obligation of the university that its knowledge and training translate out into the world, not in the classic learning, but so much goes on outside the classroom. And so I would encourage all of you to go to the universities and participate in the classes. Maybe you already do this. And if you go on Tom Byers' websites at Stanford, my brother, you'll see that a whole lot of the curriculum in entrepreneurship is in and around people from industry coming in, because who knows better about entrepreneurship than the people who've done it? It's an action sport, right?
Brook, if I remember the story of Michael that I met in Brazil, by the way, I think they were acquired by Allergan by $120 million or something like that. Yeah, that's the happy ending.
Very good outcome.
Interesting. So along those lines, if you can explore, Paul, the question that we were discussing a little bit before in our panel, the difference between investing in tech and the extra risk that we have in healthcare. So when we talk about huge disruptive innovation in tech, there are things that needs to be different in healthcare, right?
Yeah, the high-level point, I think, is that there is a lot of teaching about entrepreneurship, that you can put a pretty good product out, do it quickly, iterate fast, fake it till you make it, and that process in tech or with apps is a completely legitimate process that works. It does not work in healthcare. You cannot, in health technology, you cannot fake it till you make it. You have to be right, because that product is going to the FDA. It may take, 6 years before you have the answer, and you pretty darn well better get it right from the start. So as a generalization, minimal viable product, there is no minimal viable product, right? You have to get it right up front. I don't know if you agree with that, Brook, but...
Oh, totally. So you're probably all too polite to ask about Theranos, so I'll just talk about it.
I was going.
So about 5 miles from here, there was a company. You've all seen the book, Bad Blood. I'm going to recommend a better book to you in a little bit. And the documentary is out now on HBO and all of this. But it's an example of, it's all about the data, and it's all about efficacy and getting it right, and transparency. Everything in medical is that way. And faking till you make it, or minimum viable product, that doesn't apply at all, as Paul says, because you're dealing with human health and you're dealing with people. Now, that puts a set of disciplines in. You may have been turned off a little bit when he talked about the number of years it takes to get to revenue. Yeah, on a advanced molecular diagnostic test, it's at least 3 years plus to get to revenue under a CLIA laboratory-developed test model. In medical device, it's about 4 to 5 years, because you have to do clinical trials and show efficacy and safety. And on drugs, it's longer, except cell therapy, which is a new modality I can talk about. But drugs is, 6 to 8 years. There's some scary numbers out there from big pharma about billions of dollars and longer times, but that has to do with some older classifications of drugs. So why is it worth it to go that long if you could launch an app or do business process and have revenue sooner? It's that it's so darn hard and so complex that if you get there, you have a moat. You have not a monopoly, but there aren't many fast followers in healthcare, because it is so difficult. And it's that challenge of people who are dedicated to that gives you that advantage. Yes, there are patents, but still, there aren't many fast followers or people to share the market with once you get there.
Paul, do you want to share a little bit more some of your favorite examples coming out of Biodesign, or your personal entrepreneurial story as well?
Yeah, let me pick one example. So one I like, there's a condition called benign tremor of the elderly, which is not at all benign. You've all seen this with aging grandparents. And in a large proportion of patients, especially those north of 75, 80, the tremor is bad enough that they actually can't feed themselves, they can't dress themselves. So There is a solution to that. If you put an electrode in the brain, deep brain stimulation, if you put it in the right place, that will take care of the tremor. It's just a little bit of a heroic procedure for most 80-year-olds. So we had a team looking at that, a team of students, and the team of students looked at something Google had done. So you're probably aware that they made a spoon with a gyroscope in it that corrects for tremor. Well, that doesn't exactly take care of all of the things that those patients need to do, like take pills and dress themselves and so on. So this team went back to the needs, characterized the needs well, and what they realized was that the nerve that goes from the brain to the hand conducts backwards also. And if you get the right stimulation parameter, you can go exactly to the right place in the brain that affects the tremor. And so fast forward, this is a company called Cala that's in clinical trials, very encouraging clinical trials, with a wrist stimulator, a smart wrist stimulator, that figures out the protocol to get the signal to the right place to stop the tremor. Both a well-characterized need and a very clever insight in the solution.
Very interesting. We have time for a little bit of questions from the audience, and I'll encourage you guys to put your questions up. So we are ranking here. So what are the, continuing Paul with you, what are the major learnings from Biodesign that you think can be applied to other industries?
Well, first of all, we're deep believers in this needs-based innovation and in having needs compete with each other. I think that is a fundamental learning. So you can take a relatively small group of people, set them aside for just a couple of weeks from their regular business duties and put them explicitly on the job of go find out what the needs are in the sector we want to move into, do this process of having them compete. And it's relatively cheap, it's relatively fast, and it's unbelievable how clarifying that process is for getting the areas that you want to be working on moving forward. That applies not only to healthcare.
Brook, there's a lot of questions that are related to trends here, and we discussed talking about that. What? Trends, like major trends that you see. And Brazil maybe is 5 years behind the US in different areas. So what are those trends that we can look, that we can try to anticipate from the future and do as fast as possible? Right.
Okay, so healthcare is a massive industry sector, so there's so much going on and in research, but maybe I could just talk about the pipeline that my firm sees of startup opportunities coming to us over the past year or two that have been investable and active. So one is data, big data in healthcare, and data wherever it can be found. There's data being collected. David Schleichinger talked about his company to do a whole exome sequencing of newborns in Brazil. 300,000 newborns a year in Brazil, I think something like that. Imagine if everyone is sequenced for their exome and then that is stored as data and then tracked, and then you do that every year. Imagine what's going to come out of that. And then as discoveries happen around the world, because medicine has no boundaries, and the scientific community and the medical world has an ethos that everything is published and shared. So that's big. And then harnessing the big data for insights around, say, more efficient clinical trials. So mining the EMR and EHRs of the public and private hospitals in Brazil to know which patients have what, and a more efficient way of accruing patients into clinical trials, keeping them, having them finish out the meds, and then what the results are. Most of the costs of developing a drug are in the clinical trials and the time it takes to accrue and follow up with all of that. It's not in the discovery and R&D part for that. So that's one. On diagnostics, 80% of medical decisions are driven by diagnostics. But diagnostics, I think, really don't get the respect they deserve They certainly don't get the reimbursement that I think they deserve. But there's innovation around that, especially what we call advanced diagnostics around genomics, genetics, like Foundation Medicine, Veracyte. Veracyte is a company that was started just up the road here and is doing very well. And it was around an observation, a need, is that when fine needle aspirates are done on a thyroid, for a thyroid patient, for cytopathology, 20% of the time it found cancer, 30% of the time it said no cancer, 50% of the time it said indeterminate. Okay, so if a doctor tells you you are indeterminate for thyroid cancer, what are you going to do? Take it out. So they went after that problem, it's a really hard problem, with genetics, genomic testing and all that, and now they're saving 90% of those thyroids. So I was on the board of that company. We started a little thing where we would have a little picture of a thyroid up in the boardroom, but after a while, so many were saved that we didn't do it anymore, and then we realized it's pretty gross, actually, to do that. I probably shouldn't have talked about that. Let's see, I'm gonna do one more, which is, and recommend a book to you. So the hottest thing in medicine now is the third wave of therapeutics. The first was pills, which is small molecules based on chemistry. The second was biologics in the 80s and 90s. That's recombinant DNA, proteins, monoclonal antibodies, things like that. The new wave is cell therapy. It's doing gene modification to cells. We can now insert genes into cells for a variety of reasons. Into plants for better crops, into animals for better animal husbandry and food production, and into humans. So you probably have heard about this this science called CRISPR, and it's the ability to edit genes. So what we do with cancer patients now is we take out the T cells from the patient, change the insert genes into the T cells to make it more targeted to that person's cancer, multiply them up to like 1 billion cells, and then put them back in. This is, so the book I recommend is a book called A Crack in Creation by Jennifer Doudna. A Crack in Creation. She is the discoverer of CRISPR technology. This is a profound thing that's going to happen, that's happening. It will allow us to edit everything, including human embryos. And one of the biggest ethical things that humanity, that we're all going to face is, are we going to edit the genes of embryos? Now, there are several ways to look at that. A benefit is we could edit out hereditary diseases, like sickle cell anemia or Duchenne's muscular dystrophy or something like that. Or do we edit humans for other traits? And if you think this is science fiction, it's not. This is like right now. The Economist, this recent issue is all about this as well.
Good. Brook, let's stay with you for a second more. You talk about the why hot risk framework for startups. If you can explore a little bit on that, I think would be great. And then we go back to Paul.
I feel like I'm talking too much, but okay. Antonio asked me what framework I use when I look at a venture, and I think about it. I think about the 5 elements of risk. I think entrepreneurs have to go toward risk. You have to take risk to be an entrepreneur. You can't avoid it. If you avoid it, then go to a big company and just do that. But if you're going to pioneer, you have to do risk. And so what are the 5 main areas? One is, what's the need? What's the market? Is there a market for this? If we develop this, will there be customers, and who will pay for it? In medicine, that is the big white hot risk. You can develop something, but who's going to pay for it? Private insurers, public insurers, the individual patient. Doctors don't have enough money, so they can't pay for it. But who's going to do that? Second is competition. That's a white hot risk. How can you manage that risk? Well, you just got to be 10x better and faster. The third risk, of course, is the team risk. And it's amazing how many startup teams think that they're supposed to have a fully filled out organization chart. I can tell you just at least for our firm, we'd prefer you not do that, because usually it's your brother-in-law or your cousin who you put into some role and they're really wrong for it. Just have the core people, and the business plans I saw this morning next door, I think they got that right. And another risk is financing risk, of course, because it's so easy to get seed money now, but then what are you going to do after that? And so it's who it comes from and what they can do to help. So you can't avoid risk, but then try to identify what is your white-hot risk. Is it the go-to-market channel, or is it the product development risk, or is it something else? And put all your effort behind that in the first year or two. Most startups don't do that. They like getting really cool facilities and joining all sorts of organizations and spending all that time. They don't focus on the one main hot risk.
Perfect. Paul, you have the last question now. You have dozens of startups that came through Biodesign. You yourself, as an innovator, has come up with many different startups ideas and have gone through it. What are the major characteristics that you see on the entrepreneur, on the startups themselves to be successful? What are the major drivers of success that you see in your experience?
Yeah, I think the answer is something that people in the audience are expecting, which is it's perseverance and determination, right? You have to be absolutely willing to have a near-death experience, weekly, and get through that and stick with it. So, building on what Brook was just saying, the other thing is a realistic understanding of what you're good at and where you need to build the rest of the team. If those two pieces are there, I think those are success factors.
Great. I think it's about, well, we have 1 minute. Do you want to explore more about success drivers as well, on top of Paul's answer?
Do you want to elaborate on the success factors?
Okay.
Well, I would say read Paul Yock's book.
Yes. 550 pages about that? Yes. Yeah. But also watch the videos that they have in the Biodesign platform. And we have Brook there in the platform speaking as well, and many other different innovators. Yeah, so maybe as final remarks, for me it's really a pleasure to be here and learn with you. And I'm specifically impressed by the two of them in terms of the humbleness, the humility that they have, because being giants, they dedicate a lot of time to prepare for the panel. And so thank you so much. Really appreciate your time being here. And hopefully Brazil can learn with your example, and we can fast forward the future so we can get there faster. Thank you so much.
Thanks, Antonio.
Thank you.